Hi, this is Dr. Stephen Bracci of Verve Medical Cosmetics. Let's talk about your Botox, why it isn't lasting, and what to do about it. Well, Botox is a neuromodulator that relaxes muscles and typically persists in my patients for approximately 3 months duration. Other neuromodulators on the market, such as Xeomin and Dysport, have similar durations of effects. The effects of neuromodulators are dependent on a few main variables, however. First, there's a lot of variability within patients. Some patients get twice the duration with the same number of units compared to another patient, even when treating the same area. Number two, the number of units. As a general rule, the higher the number of units, the longer the results persist. However, there's a cost trade-off with this. Doubling the dosage does not typically yield twice the duration and become less cost-effective. 3, a new neuromodulator on the marketplace called Daxxify has been approved that is not yet commercially available. It claims to have effective results for up to 6 months. Since this product is not commercially available yet, it's unknown what the cost will be for this result or if there'll be an over-frozen appearance. So we just don't know about this product yet. The most common area I treat with neuromodulators in my practice is the glabella area, the area between the eyebrows. Most of my patients receive 25 units in the glabella area and typically have results, as I said, for around 3 months duration. However, some patients' results only last half that time, where other patients have seen to get results from this dosage up to 5 months or longer. Some of my patients, however, do request higher doses of neuromodulators with the goal of getting longer results. I have had patients receive as many as 100 units in the area between the eyebrows, which has provided some results or more than 6 months. So there's a long duration of results when you use super high dosage. However, most patients are happy with receiving the minimal dosage that will give them 3 months of results. The rationale of this is that being that more units would provide less cost effectiveness and fewer units would just wear off too soon. So there's a sweet spot with that 3-month duration in terms of cost. The main conversation your provider should cover is 1, your desired results with respect to both duration and effects, and of course your budget. If you're looking for longer results, then you should just budget out a greater number of units for your treatment. And of course, your desired level of frozenness. If you do not get the desired results you're looking for, or the neuromodulators do not last as long as you expected, then I suggest you just purchase more units as a simple first-line step. All in all, it comes down to the number of units you purchase, the cost of those units, and the results, and of course, the professional relationship you have with your provider.